talk to His Excellency, the Governor of Akwa Ibom State. Joining us today is Mr. Udom Emmanuel, popularly known as Slow Eyes, a very popular on-air personality in Akwa Ibom State. Imo, welcome to the program.
Thank you very much, sir.
And because of the gender position of the government of Akwa Ibom State today, a lady is joining us for the first time. Rose Akai needs no introduction, and for the purpose of this program, she is a popular presenter on Comfort Radio.
Thanks very much.
Have you had the opportunity to talk to the governor before?
Yes, I have. Just the eve of the election.
Okay.
Mr. Michael Bush.
Okay. What were your impressions?
Got to know the governor firsthand, very honest, and his love for God. That was very conspicuous. So good afternoon, Your Excellency.
Thank you, Rose.
Your Excellency, it's a pleasure to have you. Therefore, Akwa Ibomites all over the world, wherever you're watching us from or listening to us on radio, I'd like to let you know that this program is on air, online, and mobile. We are on radio Akwa Ibom, 90.5 FM Comfort, Radio Inspiration, Excel, and of course Atlantic Radio. We are also online. You can join us on the Facebook of the Akwa Ibom State Government, on Twitter, on Instagram, and of course on the governor's personal handles at Mr. Udom Emmanuel. When the time comes, we'll give you the opportunity to interact directly with His Excellency the Governor. Your Excellency, as is our tradition here, let's give you the platform. Talk to Akwa Ibom people. What have been the latest development since the last time we met?
First of all, let me, as usual, extend my sincere regards to all Akwa Ibomites in Nigeria, in the diaspora, and also thank God for our lives. What we are seeing today across the globe could have been worse, but this is the best out of the worst situation. This would have afforded people that God is their own, and in that case I'm talking about Akwa Ibom people. Let me also say here that in spite of the prevailing dangers, a whole lot of issues around COVID-19, when we were much younger, they used to, if a situation is so serious, they say, is it as serious as stopping a church service from holding? But I think we've seen a situation now where virus had actually stopped church services across the globe from holding. So it shows how serious that could be. As usual, I'd like to start with my usual announcement. From the last time we had the media interaction with the people and I answered your questions across the globe, there have been a lot of developments. First of all, on COVID-19, let me state categorically clear that we are at the stage of community transmission. And once we are at this stage, what I've been preaching, what I've been saying all of the time, must come to play. You must protect yourself. Please, you must protect yourself. At this moment, everything is important. Don't ignore even a sore throat that you have at this moment. Please. You can't ignore anything at this moment. Sore throat, unusual sneezing, anything coming your way, you cannot ignore. You must tackle it as you're feeling the symptoms immediately. Don't wait. Because the reason I'm saying so is that as of today, this is still very novel. There are a lot of claims and counter claims, people coming up with all, sort of behavioral pattern of this pandemic, but nobody seemed to really know in total what it's all about. We've seen a whole lot of conflicting cases with what the bookmakers have actually said concerning it, but we still watch it, and nobody claims to know it all. So please, don't ever seem to understand or to know all about this coronavirus. And we're also still seeing cases where people don't take it serious. People don't take it serious. I still have thousands of people sending me requests that they want to see me. The world is changing, we have to change. I think we'll get to a point that a whole lot of meetings that we'll be holding must be through any of the electronic platforms. Please, we must adapt to that. Thousands of people sending me messages that you want to see me. I'm sorry, at this time, I may not be able to honor all your requests. I need to be alive for you first as your governor. And I need to also take all precautionary measures to make sure I abide to what I preach. So don't keep sending me repeatedly that you want to see me. No. If that thing is so important, let's engage ourselves on phone. I mean, what matters most is communication. Any means we can communicate, actions can still be taken. People know me for execution, not just saying those things. So once we can communicate, I think we can execute without necessarily having one-on-one contact. So please, don't take an offense for now. I may not be able to honor those requests for now. There are too many, in thousands, hundreds of thousands of people that want to engage me on one-on-one. So please, I'm trying to minimize that for now. I'm not avoiding, but I minimize. Because this thing is not written on anybody's face. And your reaction to it might be completely different from another person. So I don't also want to take things for granted. But let me also say here that so many people don't believe in this. We are giving guidelines. And unfortunately, people should be aware that we are at community transmission stage. And so many people could carry this thing without knowing they are carrying it. Unfortunately, for a lot of black people, symptoms may not show. WHO came up last month and said that after 10 to 12 days, you cannot transmit again. Another school of thought are also trying to say something completely different. So we don't know. Africans, we don't do the research. We only rely on research is done by these other people. So don't blame me if I try to be a little bit careful, but please, as careful as I am, I want every Akwa Ibomite, anywhere you are, to be as careful as we preach here, please. It's quite essential. Don't wait to realize that coronavirus is real when it is too late. We have cases where people had realized this thing when it became too late. And thank God, because it's just by God's grace. Because there are some people who also experience that we administered all the drops we've administered on other people, given even better conditions, and still they didn't make it. So you can question the secret things. It falls under what God says, that the secret things belong to the Lord our God. Let me also correct one thing that some people had actually noted. If you see, they've recorded additional 4 deaths for us. Not that those 4 people died in one day. So please, you send these reports to NCDC over time, but they don't update on time. These are number of deaths over time. And we try to be as transparent as the rain drops. So once we've tested you, no matter how the family try to build up cases, you've tested positive and you die, we try to report to NCDC. Reason being that so that we can also guide the family, follow through the normal procedures. So please, if you see additional 4 that we reported over the 3 that there have been over time, the whole 4 is a build-up over my last appearance here and up to today. It did not happen in one day. And some of the names of people you already know. So it's built up over time. But NCDC did not update it on time. They just waited and just reported everything on time. Still on what we've done so far. The second PCR lab. You know how NCDC celebrated the first one that we started. I'm glad to announce that the state has set up a second PCR lab and is 100% ready. We're only awaiting NCDC certification. Once they come for certification of that second lab, we will be more aggressive in testing. I'm sure a lot of people can discover that we've tested a lot now. Initially, we were waiting to be testing people based on NCDC guidelines and WHO. But we discovered that the way these things are going, it might really take time. And some people just move along without meeting those guidelines, and they may go untested. So we are trying to actually be a little bit more proactive, test people in a manner and a scientific way that can only be described by medical scientists, which I'm not one. So I think during the normal press briefing of the Commissioner for Health, with the chairman of COVID-19. We will let you know the criteria they are using in selecting those they are testing. But it's not what you're reading in the social media. We are not testing somebody simply because you work with the governor. No, not at all. There are certain criteria they've set up. Right now, we've moved into ministries, parastatals, and even other people. And also be aware that we don't discriminate. Even when we get calls from villages, our ambulances are always there to bring those people to our triage, which will pass through our normal processes and procedures, and then we determine whether to admit the person, get the person treated, even before testing at times, depending on the period. So we are doing everything humanly possible to ensure that we save lives. That's our target. It's not what we report that matters. It's not the numbers that really matter to us. What really matters is, have we saved lives? That's our key cardinal watch action here, and we'll continue to do that. So irrespective of where people are, the last time I reported that we've increased the number of ambulances that we have, and some of those ambulances are well fitted and also well kitted too, with basic medical apparatus that can actually sustain emergency until you reach where you can be helped by the experts. So we'll continue to do that. So with the second PCR lab now, once we have that certification, then we'll increase a lot of testing because we really, really need to know. Over time also, I've announced some tax reliefs to various segments of our economy. It's our response to, at the beginning of this, I said that it is not COVID-19 that is just only the major problem. That a bigger problem will be the impact on the economy on Africa as a whole, not just Nigeria. And I think people are beginning to feel it, people are beginning to see it, and we are doing everything humanly possible. And that's what led us to the second palliative that we are sharing right now. Let me thank those who have sent me messages appreciating the quantity. We actually got support from COVID, so that we added to what the state government had to make it a lot more. So people are quite impressed with the quantity that we've pushed through. We're also trying to do this. You could see we've introduced also a lot of Indomie, sugar, and so many other things because of school children, because of the children, because we are trying to total with an experiment and also see how that works. We cannot continue to keep our students and our pupils at home indefinitely. So we are building up a process, we are building up a procedure, we are building up a test mechanism where we can take to a situation that very soon we'll announce the date. We are trying to defork all the schools before we announce the date. We have deforked those schools, we'll announce the date. We want to start with JS3 and SS3. And then allow them come in and prepare for exams. Mind you, these people will come in and prepare for external exams, which those examinations are not controlled by the state government, and we want to be very competitive. One thing you need to know, by next year, nobody will remember there was coronavirus. So if we have a very low pass mark, we'll work against the state. And we are ramping up to make sure that we don't always go below 80% pass rate in this external exam. So we need to get back these students to where we can teach them. We will not crowd the school campuses. What we intend to do is to limit the resumption to SS3 and JS3, because those are the two categories that will be writing external exams. So we'll take them through. We've done a whole lot of things. We are trying to put certain things in place. The state government has acquired a whole lot of hand sanitizers. It might not go around all the schools. I don't want to promise that because I cannot exactly say hundreds of thousands of quantities that we have right now. We've even gone ahead to see furthermore what we can acquire that can help students resume. Even in terms of face mask, what we have today might not go around all the schools. That's why we said parents must add that as part of the school uniforms. Every single child must come to school with a face mask. And if it does not have, will not let that child or that word of yours resume classes. And those face masks, you don't just sew one. These are not that, I mean, what you sew, I mean, if you just get a normal piece, you can get up to 5, so that you can wear different ones each day to attend school. You can do up to 5 at the same time, so that when that pupil comes back or a student comes back that day, you can actually wash it and then use a new one the following day, and then use 5 over time. But please, we must work with one another. We must work with the parents. We must work with the guardians to make sure that these students, you know, haven't been out of school for almost 4 months. And thank God our state, we tried to close the second term. It's only we never started third term. But haven't stayed at home for over 3 months. Some of them, even though we've been running school on radio, but so many, we cannot assess the level of concentration when they are at home, and how much they've assimilated even those things that were taught. Nothing passes that school environment where they can actually be taught and they can actually also learn. We know the elite class, their words, their children have a way, some of them even get up to the point of having video learning. But you know, the essence of government is not for that class. We are for the downtrodden, we are for the masses, we are for the grassroots. So whatever we do as government must get to the poorest of the poor to have almost the same access to the richest person who has chosen to attend public schools. So we'll maintain this standard, and please want people to abide to that. So very soon, and we want to resume as soon as possible. The Minister of Education will be monitoring when WAEC is likely going to set time for the exams. And we don't want it to be so close to the time we are resuming. The time of resumption should at least give the students time to adjust to the school environment again, adjust their behavioral pattern, set their mind again to the fact that they are students at basic level and they must rise up to write WAEC and give us the kind of pass mark that we intend to at least score as a state. So these are key issues that I am taking pains and taking time to explain in a very slow manner. If it's possible, if I know how to speak Pidgin very well, could be before I end the program, I'll change it to Pidgin so that I can easily understand. Then another thing I need to let people know, we announced tax relief, I've already said so. Udom Air has started operation because, as I said, we can't lock down our economy indefinitely. So we've started some new routes, it's been announced. Those who have congratulated us, we really also appreciate that. But we've also noted high concern of non-compliance by people that we meet in the street. We have monitoring teams in the market and everywhere. The level of non-compliance is getting higher. We were thinking the level of compliance should be what is getting higher, but now it's the level of non-compliance that is getting higher. So we still appeal to people. In this case, government can only do very limited steps in the entire guidelines measures. You have to do a lot more for yourself. Please determine that you don't want to contact this virus, and that will save us a whole lot. Once you contact this virus, as a governor, I don't sleep because I work round the clock to make sure that we save your life. You can also reduce that pressure on government and even also on your family members, because once you contact this, you expose your entire family and your loved ones at risk. So please comply with this. You don't need to go out when it is not necessary. If you must go out and it's necessary, make sure you obey simple hygiene. That will help us a whole lot. Wear face mask. If you're going to public places, sanitize and get a lot of things done. So please, we must comply with this. And we've also tried to set up some cottage factories who are working on right now. As government, we also believe the first set of what we'll be rolling out of those factories will be giving them. Government will off-take, and then we share them to schools as they reopen. For example, we are setting up one of the best toilet roll factories that you can ever think of, using bamboo fiber, which is one of the best. It will compete favorably with the best quality you can have anywhere in the world. So as we roll out those ones immediately on a test run of that factory, we send all of them to schools as part of hygiene and everything for pupils and then students at the basic education level. As of today, since COVID-19 started, the number of deaths we've recorded in the state, even though a lot of people tried to get back to us, they said, no, this person did not die of COVID-19. We don't know what killed him, but we are government, we follow a scientific method. Once you've tested positive, irrespective of what your family attributes towards that death, we don't actually bother. But since COVID-19 started in Nigeria, as of today, we've lost 7 people who are tested positive, whether they are directly associated with this or not. But there's something I need to let people know. Out of these 7, if not all, come to us when they are almost at a helpless point. Please don't do that on just exposure to your family once again. There's a case of one of these 7 that died, as at the time he was at our triage, he could not breathe. He could not breathe. And 100% of these 7 people are those that have what we call comorbidity. And what we are experiencing nowadays in the state is high degree of diabetic condition on people. People don't check their sugar level. Coronavirus hits high sugar level to no end. So please, it does not take that much. I'm trying to discuss with Ministry of Health how we can also make these kits available. There are some minor kits, very cheap kits, which you can just pierce your fingertip and then just place it and then just test as you are, especially if you know you are up to 30 years and above. You cannot afford not to check your sugar level on a regular basis. Please, there are a lot of people that feel they are very healthy, and when they come to our triage and then we check their sugar level, they are way out. They are way out. If you're unlucky, God forbid, if you're unlucky for coronavirus to attack you when you have a serious chronic diabetic condition, it creates a bigger problem for us. It is one of the most difficult situations to manage anywhere. If you also have a cardiovascular problem, respiratory issues, you're hypertensive, please protect yourself. Please, we are not interested in the numbers. We are not interested in the numbers. We're interested in your life. Protect yourself. Don't be asking me questions about the numbers. No, I'm more interested in your life. So protect yourself. Some people don't even check their blood pressure. And it's unheard of. And what surprises me is some of these people are well-exposed people who do not check this. How can you go about with the type of food that we eat in this part of the world? We take a whole lot of carbohydrates and the recipe of sugar in our system. So, and people will just go about and without checking their sugar level, checking their blood pressure, because at the initial stage, once it gets a little above the normal level, we can do something at that point. So please, don't wait. The whole 7 people that we are reporting today, all of them had terrible diabetic condition. In fact, 2 of those people, by the time we sent ambulance to go and bring them, they were already in coma. They were already in coma. So the diabetes had risen to a coma level that they couldn't breathe. But unfortunately, that's the nature of COVID-19. You don't even know who will test positive and who will test negative. Because with somebody who is already in coma under diabetes, you go and test and you discover the person is positive. You don't have a choice but to report. But within your common sense, you might start saying, oh, actually, you know it's diabetes that killed this person. But you know, since COVID-19 started, everybody who is in such condition, or if you lose anybody, I mean, we try to also check to make sure it's not this. But I also want to say here, whether there was COVID-19 or not, this set of people would have still been at a danger position. Please help us a whole lot. I'm taking pains to explain this. I'm not a medical doctor. I'm not a medical expert, but I'm just explaining a layman's knowledge. I may not have as much knowledge as you may have, but I've seen situations where the medical experts argue with my elementary knowledge. And at the end of the day, it's my elementary knowledge that saved the medical experts who argued with me. So please, some of these things could be like a mechanic who repairs a fairly used car. It's based on experience and what you see on a daily basis that we use to advise people. So let's try and keep safe and also make sure that we follow everything. I announced curfew of 8 p.m. to 6 a.m. The curfew will continue till 31st of July. By the end of this month, we'll review the security condition. As I said earlier, Our own curfew wasn't just because of COVID-19. We were combining that with the security situation as well, because we needed to manage the post-COVID security situation. It's a challenge, and that's why we emphasize that curfew of 8 to 6 a.m. So please try and abide to all this. Finally, let me say here, people in churches, people are doing weddings, people are doing burials. We set standards, we set guidelines, but people are not following. We say if you're doing burial, you must bury your loved one at this time. Number one, please obey simple guidelines. If you're doing it outside, not more than 50 people. We have our reasons of saying that. They must wear face mask, they must have hand sanitizer, and all the guidelines that we set up. And if it's inside a church, it should not be more than 30. People are flouting this. People are trying to call governor a bad name, because I try to show a little bit of understanding, in the sense that I don't want to add to the pains of you losing a loved one. But don't also try to take it for granted as if government, what can they do? We are not doing this because we want to show strength. We are doing it because we care for your life. We care for you. We care for your family. So please cooperate with us. Don't just flag this. If you must bury your loved one, else you wait. The person that died. You can also wait. Let this thing just subside a little, or let's try and see whether those who are developing vaccines can come up with something. But if you must bury that person now, bury in line with the set rules. So please, let me still make that announcement. I just discovered the reports I'm getting at weddings. People are just flouting it anyhow, hugging people, doing this, and that's why we're having increased cases of this community transmission. So please, let's obey this. I don't want to go further. I don't want to take everything on my introductory remarks and announcement. I believe on the course of your questions, I should be able to take a lot more. So please feel free, get online. James, Imon, Rose, they're all here to also fire their own questions. So if you cannot reach us on the phone lines, you can pass it through any of them, through their, I think you have a way of sending them text messages. I should be able to answer those questions. Don't rush to go to the social media to bring down your state. Ask me, that's why I'm speaking here now. What I will tell you will be nothing but what I know about it. And people who are close to me know as much as practicable. I don't dissemble. I try to tell what I know. If I don't know, I tell you I don't know. If I don't want to answer you, I tell you, well, I change it to vernacular and answer you in a way that we can keep it in-house. If I don't want the whole world to hear. But please feel free to ask me. Don't go and ask the social media people. They might not tell you the real situation. Once again, I welcome all of you to the program. And I pray, since you've listened to me today, God will continue to keep you alive so that we continue to interact. It's not in the best interest of anybody to lose a loved one. But for those who have lost any person close to them because of COVID-19, our heartfelt condolences, and we'll do everything possible to make sure affliction does not happen many times to us as a people and to you as a family. Thank you and welcome to the program.
Thank you, Your Excellency. I know Rosie, you want to ask questions, and mine is just thinking aloud, Your Excellency. Before they ask a question, I'm just thinking aloud. The picture you've painted about our community spread, I mean, it's scary. Rose will agree, Mo will agree, if you interact with the people of Akwa Ibom and elsewhere in Nigeria, people are living their lives as if nothing has happened. I mean, when you listen to this kind of analysis Excellency has presented, Your Excellency, I mean, what would you advise upon the people in the light of this kind of picture you've painted?
It's people that spread the virus. It does not spread itself. So it's a very simple thing. If you make up your mind that this virus will not enter your home, it's not by faith only, but faith without works is useless. If you have the faith, it will not enter your home. You must show that faith by the works you do, by obeying the simple guidelines. It's as simple as that. So it's not enough to have faith. There's a family I visited. They said, no, coronavirus cannot pass our gate. And meanwhile, I entered the place, I expected to see some minimum, or let me say minimal level of compliance, and I didn't see it. So it's not just enough. Fine, faith works. Please, it should be faith over fear. That's always what I say. But I also want to see deliberate attempts by Akwa Ibomites to ensure that we keep to the rules of whatsoever is happening around the globe so that we all keep safe. It will be very, very interesting. I'll be very happy to just feel. Well, the essence of mentioning community transmission wasn't to scare, nothing to scare anybody about. What the situation we have today is still very, very excellent. Mind you, as of today, the only active number, even with all the testing, between the last time I met with you and today, we've tested 1,103. That should show you that we are very aggressive in it. And out of which, we had only active cases of 80. So that's not bad by any standard or by the world standard of today. But I'm saying, let me test 5,000 and let me not even get any, because I don't wish it for anybody at all. I don't wish it for anybody, because this thing is sweet when you're only reading it. God forbid, I don't want anybody to experience it. So it's not to scare people, but it's just to let people know that that's the stage we are. Once you are experiencing a pandemic like this, there is nothing you will do that will not enter a community stage. I'm saying that is the stage we are today. It doesn't mean everybody you see on the road has it. But if you live that kind of life, it will also help me. If you suspect every human being you see on the street, it will make you be more cautious. So in that case, you won't throw caution to the wind. The last time I came here, I told you that it's only me and Donald Trump that are allowed not to wear masks. But today, you can see I'm even wearing masks. I had to just open my mouth to be able to talk to the world. So that shows that even me too. I mean, I'm over-complying now. It's over syllabus I'm doing now. Over-complying gems. So I also want people to just have that consciousness. It's not to frighten anybody. While government is trying to put in gems also, between the last time I was here and today, we've gotten 3 more containers of medical equipment, all cleared. If those doubting Thomases that want to read, if you come, we open and then we'll show you. I'm sure you are here that our emergency unit, had been adjudged as one of the best. So we're doing a whole lot. We're investing a whole lot of money. The state government has spent over 3 billion on COVID-19 in everything, treatment. And also know that every single person who are tested positive, government feeds that person 3 times a day, free of charge, free medication, free treatment. There's nobody who had paid 1 naira who tested positive to COVID-19. Even some of the people who came in at the end of the day who tested negative, but because of the nature of ailment they had, we treat them 100% free, and we feed them 3 times a day. And you know, 90% of these people are, as I said, are diabetic patients. And you know how difficult and how expensive it is to actually feed a diabetic patient that is under treatment. But state government is doing that all through. And upon that, we still find way to go out and buy the second batch of palliative and still distribute to people. We are buying equipment, we are buying ambulances, we are investing a whole lot. I don't see these things as expenses at all. I see them as investments. That's why I keep calling them investment. So between the last time and now, I've had 3 more containers that we've brought in, all medical equipment. My target is to have a minimum of 49 ICUs in Akwa Ibom before we leave office. 49 functional ICUs. Because I know, when we're bringing these things, a lot of people didn't know. And I remember some of the statements I made when I was opening some of these hospitals. I said, there could be a condition in this life where 30 minutes could be a whole lot. Lo and behold, coronavirus came. And look at all those ventilators we brought in that time. People did not know that could be useful today. Since coronavirus started, we've not gotten help of even 1 ventilator from anybody. But even as of today, I'm not sure we've used more than 5 or 6 out of the 13 we had before coronavirus. So you could see that by any standard, we've done well. And God has actually helped us to, before now, be proactive in taking the right step towards Medicare in our state. And we want to live it in that condition. I made a commitment that every federal constituency will have a very functional general hospital. We're almost there. Ikoro, we've done a whole lot now. Ikorobasi, we've awarded. I think those were the only 2 federal constituencies remaining. All other federal constituencies have at least 1 functional general hospital. So what we need to do now is to rev the equipment, the consultants, the manpower, and all the facilities around those ones that we've done, and then take it to a certain standard. Even other ones we've tried to do, like formerly leprosy hospital in Etina. If you get there now, you see the volume of work we've done. And I also want to change the name, because that name, I don't know. We were using that name, leprosy hospital, in those days, hoping that some NGOs will come to help, but it's not sellable again. I don't want in 21st century to be saying that we have a leprosy hospital in Akwa Ibom State. So we're going to change that name once I finish the renovation, and changing that place to a full cottage hospital. So we'll find a name and give it, and then change that name. In 21st century, I can't still be saying that we have leprosy hospital here. No, not at all. So we're doing a whole lot, and we'll continue to do. Let me pause.
Quickly, Your Excellency, picking from your statement so far, you made mention of over 1,103 tests so far, and still counting. Over 3 billion naira in investment as far as COVID-19 is concerned in Akwa Ibom. 49 functional ICUs and more, even more than the capacity that is needed at the time. But let's put this side by side with the current global trend as far as oil is concerned and what is due at Akwa Ibom State. How are you actually able to put this together in the face of the financial burden that the COVID-19 has put also on Akwa Ibom State? With very little support from the federal government.
Ima, I want to thank you. As of today, I've not received 1 naira yet from the federal government. 1 naira a time. It shows the premium we place on the lives of our own people. I can sell my private property to save a life.
Really?
Honestly, that's my attitude towards this. I can sell a private property to save a life. Because you see, you don't know the life of that person, what that life carries. I keep saying so. Where you have the greatest inventions of this world, the greatest ideas of this world, is in the cemetery, aborted. So we can't continue in that trend. And if you talk about the finances, the reason God brought people like us at this time, God knows that this time will arise, and He will need people that can conveniently manage the resources of the state. We finished a meeting this afternoon, a meeting we call Finance and General Purpose Committee meeting. We were assessing roads we've done across the entire state and everything. By the time you put this together, the same questions were coming up from everywhere. How have we been able to do this with the meager resources that we're obtaining? And we're still paying minimum wage. I've just finished a salary review, upward review, some of them even up to 80% for health workers. That the team they call, is it Johesu? I think the minimum review we've done is 70. We've done between 70 and 80% review, which I just signed up, which is to be implemented almost immediately. The reason being that these people are exposed. These are the health workers. These are people working throughout this COVID-19 and so on. So it's just that passion at what we have. And there was a program I attended, and people asked me similar question. I told them there's a difference between cash and money. And why God gave us the wisdom is so that we can create money in the face of no cash. So I think in the face of no cash, God is helping us to create money in order to be able to render those services. I will end there, because if you want me to expand on that now, the whole time of the program will go. But I just believe that God, in His infinite mercy, made sure that people like us could sit here now, where we are extremely selfless in what we do, and we have the passion to get to any level to make sure that we save lives. I keep saying so. Even the palliative that we buy, I still call it investment, not an expense. Same thing with education. 2 categories of social services we render here, that we don't take them to be expense, but we take them to be investment. Because whatsoever you do in healthcare delivery system, it's often said health is wealth. Health is wealth. And even when Paul Apostle was given an opportunity to pray a prayer, you know what he prayed? Just 3 points. Be in health, prosper as your soul prospers. So it shows how relevant health could be.
Very powerful.
So you can't go outside that. There can't be prosperity in the land when people are not healthy. So that's why we see it as a major issue here. money or no money, we'll try to do our very best. Money is essential. The Bible upholds two major things as principal things in the Bible. If you read, wisdom and money. So, as of today, I believe God has given us wisdom, and He's giving us money. Small. I mean, I still say so. Whatsoever we have is the best out of the worst situation. I'm one person that even if I have a dime, I thank God for it, because I know God knows why He's giving me a dime instead of billions at that point in time. Some of these things you never can tell. If you're faithful in a little, God will give you a bigger one to manage. So the most important thing is it is required of us as servant leaders to be faithful in what we do. So it's through that faithfulness, through that sincerity of purpose, through that transparency in all this, that we can get to where we're going to, but we'll get there.
Your Excellency, you have lamented the non-compliance of the guidelines, COVID guidelines in Akwa Ibom. And now we see that, James also talked about the fact that we see that every day. I see that every day. More sees that every day. How do we enforce these guidelines? Because obviously it looks like the people aren't listening, or they are lackadaisical. What do we do? Who do we bring in? What organizations or security agencies do we bring in to help enforce these guidelines?
Rose, you're quite right, but I'm just trying to make sure that I don't use the words I shouldn't use when I'm on an international platform. But it's difficult to deal with human beings generally across the globe, no matter anywhere in the world. Man remains man and remains extremely difficult to manage. Because I don't see why, with the level of preaching we've done, we've set up monitoring teams to even monitor what people do. And if you check, these people are all adults. They are not little children. Little children are even a little bit more, a lot more resistant to what is happening around COVID-19. If you look at the level of, little children infected, it's quite minimal. It's not even up to 1% of any of the numbers you're mentioning across the globe. Check ages 1 to 15. I don't think they are more than 1%, or even they should be less. The main people are the adults, and that's the problem. And do you know the category? It is the age between 25 and 30, say 25 and 40, because they are quite mobile. These are people who are quite restless, and they are the agents of transmission of this community transmission. So we've done everything possible. We've preached to these people, we've talked to them. Unfortunate situation is that some of them end up with this virus and start experiencing it and start regretting. So that's why we keep talking over and over again. We've told people in churches, because 99.99% of Akwa Ibomites go to church. They go to church. So people in churches, please, even when you're preaching over the radio, your opening remarks should be, try and comply to these guidelines. If we can have the level of compliance, we can reduce this number drastically. I don't know, you can't beat people because they are not complying. That would be very barbaric. You can only use moral suasion and be as persuasive as possible whenever you're trying to let people know this. We've created awareness. If you check the radio, we are creating a whole lot of awareness. Even all the schools we want to resume, we are trying to put billboards in those schools so that people can read. And that's why I'm also here. Before COVID-19, I didn't come this often on a platform of chatting with my people. But this is as a matter of, urgent need at this moment, that I must be here to interact with our people and also alert the face of people. It's not also a death sentence, please. Let people not feel that way and be so much in fear. No, the whole idea is not to create fear. The idea is to create awareness and try to use preventive measures rather than waiting for this thing to happen and then we start spending money to see how we can get you cured. And that's why it sounds as if I'm lamenting. I'm also lamenting because I know these things are avoidable. We can actually checkmate it if we live the way we should live. We can checkmate it. And I know there are situations we faced because of the opening of interstate borders. Akwa Ibomites who were in other places, who were not well taken care of, a whole lot had returned. I don't want to emphasize on that today. I think I spoke a whole lot on that the last time I was on this program. So many Akwa Ibomites who were outside Akwa Ibom had returned, and we cannot send them back. Even this afternoon, we just had a case of 2 people who tested positive elsewhere and just found their way in. And we took them in immediately into our isolation center. They were not even tested here, but they have the certificate that they tested positive. So we took them in, started treating them. They are Akwa Ibomites. I couldn't send them away. I still believe those people too could have helped the family members by exposing that, look, as we are coming, we are positive. Don't come close to me. They wouldn't have even gone to their family houses. But right now, they would just be here that nothing happened. Went to family house, interacted with people, and they leave me now with the problem of contact tracing. And it's expensive to put people to contact trace this. Between the last time I was in this program and now, we've received 4,673 calls in our situation room. 4,673 calls received so far at the call center in our situation room. That will tell you that we are very active. And our situation room runs 24/7 with medical experts there, with all facilities we are using to run. That's where we also monitor so many things happening. We've had about 121 discharge cases. So these are numbers. That's why I said today I don't want to delve so much into the numbers. I'm not interested in numbers. Even if I've tested 1 million people, that's not what I'm interested in. I'm interested in people trying to take just those precautionary, measures and make sure that these things do not spread. And also human beings being conscious of their health. A lot of things happening around health depends on your lifestyle. And one of those people, no matter, you might quote me wrong, this is a personal opinion. I'm not saying this as a governor, I'm saying this as Udom Emmanuel, that even a lot of things we call hereditary, that's how you call it, Rose, hereditary in medicine, is not because you are a son or a daughter of Imo. No, not at all. It is because you're living the same lifestyle Imo lives. Check our children. What do they come to learn from us? Pandeyam, Afam, Fufu, Gari, and this. The children from the other side, what are they learning? Leaves, cabbage, raw onions, raw tomato. We are not talking about those people that chew raw insects. No, not those ones. So, you see, you take after what you were born to see, what you were born to know how to eat and so on. And because of lifestyle, it seems as if those things just pass on from your parent. No. I'm one person that believe might not necessarily be so. So it's the same way in this case. If we just determine that, look, we will not just look at what is happening. Someone will tell you, oh, I look at TV as a place. I think life is still going normal. No, it might not be the same. It might not necessarily be the same. So you can decide to just say that, look, we want to minimize this, and it can be minimized. People just take these things for granted. And unfortunately, I shouldn't say this on a live program, but it's just for people to take a little bit more steps to guide their hygiene standard. Even this thing, I have big, when you say big, underline big men of God who also probably must have thrown caution to the wind. And we're also treating them for this COVID-19. It shouldn't be. These are people that are supposed to preach over this. But at the same time, let it not sound as if I'm overflogging people. I've also had somebody who said he had obeyed all procedures, all guidelines, and he still tested positive. In that case, what could have happened? What could have happened to such a person is, why is keeping to every single does and don'ts? You understand? What he failed to understand was that his house help, his steward, his cleaner may have gone exposed and then brought the thing to the house to him. So this is also another aspect. It could have even been his driver. This is another aspect that people ignore. The same standard you're keeping, please make sure people around you keep that same standard. Your driver, your house help, your niece, your cousin, anybody around you must keep the same level of hygiene standard. And with that, we won't have any problem.
Okay, excellent. Thank you, Excellency. Excellency, I want to report there are so many people across the world are trying to join us online, on mobile, so many calls. But before then, I always like to...
we have to give them a little time today.
Yes, of course, yes.
Last time we cut them in 1.5 hours. So today we'll try and take it up to 2 hours. Okay. So I'll be here till 6 p.m. so that 6 p.m. Nigerian time, not American time.
Thank you, Excellency. That gives us that. So, Excellency, I like talking the economy and fiscal policies. earlier, everyone mentioned the fact that I'm not the nation. I mean, most of all has come from anywhere from the federal government. And we do know that in terms of federal education, is at the lowest, maybe because of COVID-19. Research, little read from there and there. I do know that maybe for this month, Akwa Ibom is so badly hit. But irrespective of these, we've seen your government introduce some tax relief in the face of these very difficult times. We've also noticed that you set up the Department of Multilateral and Donor Agencies. How do these play out at a time like this when there's paucity of funds and there are so many programs to undertake? This tax relief, will it not somehow affect the IGR, considering the fact that there's no support from the federal government? Nutrition from that source is also very satisfying.
Thank you, James. I'm one person that there are different definitions of love. At a times like this, or at times like this, and at a time like this, love is defined as a sentiment. Love is defined as a sentiment. So the sentiments that inspire what you're saying is woven around that word love. That's why I say at a time like this, you define love as sentiment. Love is sentiment at this time. So because it's sentiment, you must also try to see what can you do. What the sentiments that inspire actions you take around this time must be woven around that love for your own people. The question now is, we must also look at how can we create some relief for our people to survive. As a government, we must also tighten our belt at this time. We've reduced our expenditure pattern drastically. I think we've cut down on our expenditure seriously. And we've gone back to what I call the WEN principle. You know what they call WEN principle? WEN principle is W-E-R-N. They are in capital words. That W is whatsoever we spend now as government must be wholly, exclusively, reasonably, and necessarily incurred. So, let me repeat. As government, we've gone back to make sure that whatsoever we spend at this time must be wholly, exclusively, reasonably, and necessarily incurred in running the government of the people, for the people, and by the people. That's the elementary definition of democracy. I don't know. So, I'm trying to say here that any situation you find yourself, you must find a way to survive out of that situation. There's no how. If the children of Israel got to a point that they needed water to drink in the desert, and it wasn't the will of God for all of them to die at that same time, there was a way. Moses had to look for a way. He got to Joshua's time. They also had to look for a way. It got to a point they had to go spiritual. So there's a situation you find yourself. You must deploy everything God has given to you to make sure that people survive, because you cannot sit down and just be on your, carry your hands or your arms on your head and just be crying over something you cannot change. Situations you cannot change, you must to find a way to create change out of that situation. So what we are doing here is that we are not managing the change of the situation, but we are creating change out of the change situation that we have out of COVID-19. And we don't have a choice. We must continue to do that to survive. It is a survival strategy, and we must adopt it. So these are some of the measures that we are taking. Can we do anything to get out of it? The answer is no. You talked about creating other agencies. Those agencies we are creating is to make sure, because you see, no man survives alone on planet Earth. If you check at developed nations, how did they get to where they are? Even the human resources that they used at that time to develop themselves, they all got them from Africa. But unfortunately, when they got the human resources from Africa and used it to develop their own place, they are trying to kick us out. But look at, why do you think there was slave trade? Because they needed those human resources to actually develop. Today, you hear big countries like Canada trying to look for citizenship. It's not because of that. It is because 2% of the arable land of Canada can give you wheat over how many thousands of tons per annum. So it's not free. They are using that to also create wealth. So, in situations like this, you also look at what steps can you use to actually make sure you handshake, you collaborate. You also tap into what that collaboration could be. You see, unfortunately, We are beginning, they say world is a global village. There's exchange of knowledge, exchange of ideas, exchange of technology, but you can see there's a free movement now of all those things. Why? Because it benefits the developed nations. They are the ones who are developing, who are inventing these things. But you can see, no matter how they say the world is a global village, there's no free movement of labor. So once there's no free movement of labor, as Africa, we must still suffer some setbacks. So as a leader, you must also look at, within the limitations of which you have, what can you also do to tap through those collaboration and certain things that can be done to in order to also gain from the world as a global village. That's why a whole lot we're doing under those multilateral agencies, trying to see how we can handshake with our friends elsewhere and see how we can help our people.
Okay, thank you, Excellency. Okay, just filling in. It's been the governor speaks. Your Excellency, we've done 1 hour. We're going to take a short break. And when we come back from that break, the phone lines will be open. We'll go online and harvest all the questions. So if you cross-check our social media handles, thousands of messages and questions, and it's going to be there.
Tell them I'm here till 6 p.m. Nigerian time.
Your Excellency, let's take a short break when we return the questions. Thank you. We are on air, online, and on mobile. We are on AKBC, radio, and television. Of course, we are on live stream on the state websites and social media outlets. We are on Comfort Radio, Inspiration, Planet, Exile, Atlantic, and in fact, all the stations across the state. For those who would like to join us on the program, for those calling, making calls and SMS, you can join us via 090 724 05876 or 0808 425 45. The number is already rolling on the screen. You can join us now. Let me take the first caller. Hello, good evening.
Hello, good evening.
Good evening, sir. What's your name? Where are you calling us from?
My name is Tony. I'm calling from Nungati, Mexico.
Thank you, sir.
Your Excellency, the people of Nungati, we want to complain. Our village is the host to Shell Traffic. There's a road that links from Oron Road to Nodo. And that contract was awarded to Henry. And the road has been abandoned right now. We are going to my village from Nodo and the Lawrence Catholic School and the Lawrence Catholic Church. You cannot access Nungati because the road has been abandoned and houses around are flooded. We don't know how to go to our children. Please, sir, we need you to come to our help. We need your aid to intervene in that road project, sir.
Thank you. One good thing is you said the contract has been awarded and the contractor is very responsible. I'm sure in this program. No, don't worry. I think through this program you've heard the interviewers mentioning over time the situation we are now in terms of finances. At the time of this economic recession, the first thing you do is to make sure that you slow down on all major capital projects and let the people survive first. So please, that's the essence why we went to school. We sincerely sympathize with you on the condition of your road, and be rest assured that something will be done as soon as we come out of the situation we are right now. We are first of all at the survival point. Let's survive first. Once we survive, we'll be able to take on more capital projects. You should also even first of all appreciate us, because that road has been there since you were born. Nobody entered the road. So I came now, awarded the contract, the road had actually started, the job had started, and we are progressing. And thirdly, the volume of rainfall within these few weeks had not also allowed even some of these who are willing to run with us on credit basis to go back as soon as possible. But be rest assured, any job awarded to Hensec, he will do it well. He's a very responsible contractor because he's a local contractor. He doesn't have any state to go to. He's from Akwa Ibom. So whatsoever you give him, he does it with an extra passion, being from Akwa Ibom, and as if he's doing for his own people.
Hello, good evening. Hello? From South Africa. What? Can you speak up, please? Kingsley Bonte from South Africa. That should be the president of the Akwa Ibom community in South Africa.
Yes, Kingsley, you're on with the governor. Thank you for calling us from South Africa. Good evening, Kingsley.
Thank you very much for affording us this opportunity to be chatting to you once in a while. It's very awesome that you give us your time. His Excellency, I want to commend you. I have a few clips for each of you. Okay. What you've done in regards to the special advice, giving us special advisors, let us one time that we want to do, because that is the only way we can reach you. Working with the special advisor, I also want to encourage you to also look at people around us. Maybe we can also be presented as your spokesperson. But then another thing I want to encourage you that perhaps we have the financial directors who are trying to address through to the program of the coach. In fact, we were still sharing
Hello, Kingsley. Maybe you can speak, or you raise you raise the issue that you have a philanthropist who wants to do work for Akwa Ibom. Can you speak up about that?
Okay, I am the issue of the organization. We had a philanthropist from South Africa that wanted to do a few of the kind of work that we had.
Okay.
That was very unfortunately, we couldn't reach the president because we also got the special advisor of the Australian market and the program. I have to request the Excellency to formally increase that so that we can be able to have access to the government.
Okay, thank you, Kingsley. You know, some other people will want to also speak to His Excellency. Excellency is talking about an office for diaspora matters and someone who intends to do a school of nursing for Akwa Ibom from South Africa. He's asking about the processes through which that can be done.
Let me appreciate Kingsley for the interest he has in his own state. If somebody wants to reach us, we have a government platform. We have emails. We have different offices. We have Foreign Direct Investment Directorate. We have what we call One-Stop Investment Directorate. We have Office of the Secretary to the State Government. And recently I've also created the Office of the Chief of Staff to the Governor. And I think there are easy ways of reaching us if you're actually having a developmental project in mind. That shouldn't make that elude us in any way. So please let the person make effort to reach Secretary to the State Government, reach the Chief of Staff, reach the Governor, reach the... they can even reach you, James, or reach Cool Eyes, or even if they get across to Comfort FM, they can easily reach us. So it's extremely easy. And the issue they're also saying about School of Nursing, anything about health, I think if they go to our health portal and drop that message, it will get to Health Management Board and then the Minister of Health. We are still trying to upgrade our IT platform to make sure that we have portals for different ministries that people can actually access and get to know what we are doing and also reach us at any point in time. But as of today, I believe the basic information platform we have can actually let him reach us. So let him do that. He's also talking about setting up an office of the Senior Special Assistant to the Governor on Diaspora. We'll set that up, and we can't establish every single office at the same time, same day. We've had that up until June last year. It's just a matter of these few months that we've not had this because there have not been activities so much between us and the diaspora. You can see there are no international flights. A whole lot of things are actually not working in that direction now. But I believe if they have anything in diaspora right now, Office of the Secretary to the State Government will handle it very, very well. So let them reach out to Secretary to the State Government.
Okay. Let's take some more calls. A lot of people are trying to join us. Hello, good evening.
Yes, hello, good evening. Are you going to get your mic?
Hey, then, tell me then.
Okay, public call is Excellency very well.
So, song.
That is towards education issue. In primary school and secondary school, black body, they come out and space body job. I see the problem. So, my project that clearly whiteboard and then this marker. I'm going to get him somewhere to that job. And then we'll be in these asthmatic conditions to the people and the students as well. So that would get in time to find them from their home. If they implement anything on the door of fight to achieve for that such contract to be carried along, if we really achieve the user. So, thank you very much.
Okay, that's a mirror of in contract and not the whiteboard, right?
Yes, sir.
Okay. Let me say something here. Rome was not built in a day. Education in Akwa Ibom State is extremely expensive, and we've invested a whole lot. Look at the number of primary schools, secondary schools we've renovated under the interministerial direct labor jobs that we've given. If you look at those buildings we've renovated, we grant YF fees and so many other things we are doing in terms of education. During my last appearance in this program, I said that we are trying to bring in 300,000 books across the globe that will help, especially in sciences and areas we know we are not at least up to where we should be. And we can't finish all in one day. The suggestion is given on the new technology in teaching aids in classrooms. We are trying to build that into the modern schools that we are building right now. I'm sure the Minister of Education, during their press interaction, will also let you know that we are selecting some schools that will be special model schools that will build in terms of science and tech into the intermediate school that will now empty into the new vision of the Akwa Ibom State University. That we can only start gradually right now. I think the Commissioner for Education is listening to me. When he's talking to you, we will clarify on that. We are going to start with 10 schools, and those 10 schools will have basic, modern facilities that will aid in teaching. We cannot do that across all the schools. As of today, I think, if I'm not mistaken, we have not less than close to 300 secondary schools that are public schools in Akwa Ibom. Not less than that, close to 300. So it's not a small expenditure to carry out on that. And by the time you add primary schools, and enrollment in our schools in Akwa Ibom State today, because of free and compulsory education at basic level, is close to 1.8 million. So you can look at that enormous responsibility that we have. WAEC alone this year, even with COVID-19, people writing WAEC, I think including the technicals and practicals, is close to 64,000. If my numbers are quite correct. So these are situations that we're having. So we are gradually coming through that. People should also tie that to the mean resources that we have. The meager resources that we have. We'll try to do a lot more. So give us time. As we take the first 10, we'll keep changing and rehabilitating until we get there.
Excellency, there's a case of a very important constituency in the state, the disabled. There's good afternoon, Your Excellency. People who are blind and other persons with disabilities in the state are so proud of your administration, what the administration is doing in tackling the COVID-19 pandemic. Your Excellency, the outbreak of the coronavirus has exacerbated the hitherto deplorable condition of persons with disabilities, especially the blind. For example, palliative sent to villages do not get to these disabled people. We are appealing that assistance should be given to them. Kindly help the Association of the Blind, deaf, dumb, with wheelchairs and other palliatives. We are hungry. We also need to create awareness amongst our members who may not see.
James, I think I can answer that one in a very straightforward manner. During the first phase of the palliative, we gave special allocation to people with disabilities. Even this second batch, I think we're also doing that. So please let him know that we've never one day gone on any such thing and ignored those categories of people. In fact, we always consider them. And if you even also check, even in terms of employment, wherever there is an opportunity for us to employ people, we always give a certain number to people living with particular disabilities, and we are conscious of that. And we're actually trying to do a lot more. The only problem there is, the level of unemployment in Nigeria in particular and Africa in general is a whole lot compared to our population growth. So that's why we are revving up the engine so fast in terms of our industrialization policies.
Okay. Well, a quick one here, Your Excellency. We have a responder from Facebook by name Believe Noah. He says, he's talking about, Your Excellency, earlier you talked about community transmission or infection. With all of these investments, how would you describe the response when compared to the city center view? If I'm somewhere in the local community, would the response be the same? Are they actually captured in all of this plan for dealing or handling COVID-19 cases?
Thank you. They are all captured. We have 43 health centers, and they are all trained on how to handle cases. It's not only in Uyo that you say this. We, as I said, every single health center run by government, not even primary health care I'm talking about cottage hospitals, general hospitals. We have primary health care is completely different. Only cottage hospitals and general hospitals, we have 43 in number right now. And those 43, we've trained staff across on how to handle cases and how to handle also from the triage to where they now hand it over to coronavirus center in Uyo. And that's why we started with investing a whole lot in ambulances. If we check the number of ambulances we have, apart from those donations, we've also acquired some, as I announced earlier, and we still want to acquire more. But as of today, I don't see any community suffering because of not being able to reach out to us. No, not at all. If you suffer any of this without being able to reach out to us, you know that it's a personal problem. You've not called us. Because if you called us, any of the nearby health centers should be able to reach out to you. First of all, the essence of the triage is, I'm not a medical expert, but the essence of the triage is actually to first of all carry out that preliminary diagnosis to actually know. Because at times too, you see a lot of people with natural, normal, we are in Africa, normal malaria, cold, catarrh, people just take everything. I love that. It means people are conscious of it. But by the time we go through this, we just know that it's not all cases that could be coronavirus. But anything that is suspected to be, we send the people immediately to our center for testing. Mind you, we cannot set up testing center in all the local government areas. We don't have that kind of resources. I just announced the second one that we've just established, second PCR lab that's just been established, awaiting CDC certification.
Your Excellency.
Yes, Rose.
Just a moment now. This is quite interesting, Your Excellency.
Go ahead.
It's coming from Facebook, from a Tema Echo. It says, Your Excellency, I have a question for you. I think you should introduce an intensive and more vigorous mask mandate and reshuffle task force team to replace whatever was on the ground, knowing that most of these people aren't complying and some of these security agents have become familiar with the people in these areas.
That's really interesting. So if we know that much, what stops us from doing? It goes back to what Paul Apostle said in Romans. He said, that which I'm supposed to do, I find myself not doing it. That which I'm not supposed to do, I find myself doing it. It's the nature of man. For Paul Apostle to have actually written that to the Romans means that is what is prevailing. And it's still continuing till today. All of us know the right thing to do, but we find ourselves doing the wrong thing. So the question there is, the situation today cannot allow us continue in that. Paul Apostle said so. He said, look, to you the Romans, that which I'm supposed to do, I find myself not doing it. That which I'm not supposed to do, that's the one I find myself doing it. That please, can you change? I'm joining Paul Apostle to say the same thing. That which you are not supposed to do, please don't do it. That which you are supposed to do, please do it. That's the only way we can do. There's nothing, we cannot go to individual houses and start dragging and forcing people to do it. It's not practicable. We can only do what we're doing using this platform. You can imagine all of us here now for 2 good hours. This is for the love of our people. This is the best we can do for now. Trying to let people know that please do what you're supposed to do. Don't do according to what Paul Apostle told the Romans. That which you're not supposed to do, that's what you do. No, not at all. See me wearing this mask now. I'm only pulling it down because you guys are far away from me. If we were to discuss closely, no matter how uncomfortable this will be, I will cover up to everywhere. But because I know people are much further down from me, I can speak freely. I also want everybody in the world to hear me. That's why we are creating a whole lot of this space so that I can talk to you people. Once I step out of here, I can even cover up to my eyes if need be. But you see, people have to do what they're supposed to do. Government will not come and put a mask on your face, please. It's an interesting question.
Yes, this one, Your Excellency, from Gideon is here. He says, my dear Governor, Udom Emmanuel, please try and ease the curfew time so it can help the weaker vessel in the streets, especially those that their business is working during 8, 9, 10 o'clock.
What kind of businesses do you do at night? God created night for people to sleep.
The bars and the nightclubs?
I've not announced the opening of bars and nightclubs. If you open your nightclub, open your bar, open your drinking parlor at night, we will arrest you, please. We will arrest you. So, any business you cannot run between 6 a.m. and 7 p.m. and then continue the next day, we need to review that business. Because active man hours in most cases is not more than 8, including 1 hour break. So if we allow you to run a business from 6 a.m. to 7 p.m., I think that's good enough. Mind you, it's our duty to not just protect you against coronavirus, also secure lives and property in the state. That's the essence of curfew, and I explained this at the initial stage. But as events unfold, we'll continue to review and then know when to probably take it out. But for now, the need is still there for us to continue.
Okay, so I think we can afford to take some more calls now. Hello, good evening. Hello, good evening.
Can you increase the volume?
Hello.
Yeah, good evening, Your Excellency.
Yes, good evening.
Oh, hi.
Hello.
What's your name and where are you calling from?
Hello, good evening. Hello? Hello, good evening.
You've not placed the handset well.
Good evening. Good evening. Mfon, welcome to the program.
Thank you. Please, can I go ahead with my question?
Yes, sir. You're free.
Okay. First of all, I want to good evening, Excellency.
Good evening, Mfon. Where are you calling from?
My name is Udom Emmanuel once again. I'm calling from you.
Okay.
Hello.
Yes,
We are listening. We are listening. Go ahead.
To you.
Okay, please. I want to first of all commend His Excellency for the things you have done, especially in the health sector. Can you hear me? Hello.
Yes.
We are hearing you. Go ahead. We are hearing you. Thank you.
I want to commend him for what he has done, the effort he has put so far, especially in the health sector. And I want to I want to take a word from them that regarding the plan that schools will be open. And I want to suggest that there should be a review of the number of hours put in schools because of the first month. Just like one of the guidelines in opening of churches, that the churches should not go more than 1.5 hours or possibly 2 hours. And I want to also suggest that strongly when the state government is planning to open schools, because sometimes the first month could also be suffocating.
Okay.
Number one. And I want to ask His Excellency, what is the mechanism has he put in place so that possibly when he leaves office as the government that will continue to also continue a few things he has done, especially in the business sector and everything, carrying on with the medical facilities that he has put in place.
Thank you.
So much, Excellency.
Thank you.
Thank you, Mfon. Let me start from the second part of your question. That what can we put in place to ensure continuity? What we can put in place is to make sure, first of all, is trust. If there's no trust, we cannot move forward. First of all, you must trust your governor and trust the person that will come after your governor. How will you trust your governor? Trust your governor that your governor will not support any man to succeed him who will not have the interest of the people at heart. Not his interest. I've said so over and over again. I will never seek third term through a surrogate. Never. And I'm not that kind of governor that will start announcing to you that I want to govern for 24 years. No, not at all. 8 years is more than enough. 8 solid years of trouble is more than enough. So all you need to do is to support the governor, that whoever will come after your governor, certainly, whoever your governor will queue behind will be the person I know will have the interest of this state at heart. That's number one. Number two, will be the person I know will have the capacity to also follow. Because in the world these days, people win election through economic policies that you put in place. Because once you have a strong economy, you have a strong political power. So what people put in place first is the strong economy in order to support the political structure that they have in place. So support your governor, that your governor wishes everybody well. And I do my very best to ensure that what we get is the best that God can afford. So that's one thing you can do. Then number two, he was talking about, James, what was his first part of the question?
The first part of the question was when school reopens.
When school reopens, yeah, thank you. I've been reminded. When school reopens, that's why I say wait for our guidelines. What you are saying is as if you were part of our meeting. We have actually analyzed on that when we open schools, number one, we'll minimize the time for break. Because it is only when you have an extended break time that those pupils and students play a lot and they get to, engage themselves. So we will reduce the timing of breaks and also reduce the time they spend in school. And I didn't want to leak this one out, but since you are present to see how much we care for students, you can't believe as of today we've acquired a whole lot of biscuits and soft drinks that we want to use to just test something. That if we actually look for a way to, reduce the number of people who come to school, you know, even though you run free and compulsory education, I mean, that's what breaks my heart. There are still a lot of families in the local areas that these students still come to school without a meal. Without a meal. I wish we can afford to even get those people at least something to snack on while they're in school. But we are trying as government to see how we can ameliorate that initial stage. So we've had some soft drinks, Coke, Pepsi, water is not inclusive, some biscuits and so on, which will pass to some schools. It might not go around all the schools, but we are using population in schools. That's number one. Then number two, we are trying to get this to the local community, that we think some of these students can actually get to the class without a meal. To see, we are experimenting on something. I'm not saying it's going to continue. I'm not saying it's a standard, but we are getting somewhere. We are undergoing a study. So once you are undergoing a study, you put so many things in place. It will cost you money, but you are trying to check behavioral pattern of certain things so that you can arrive at a more appropriate decision that will guide how schools will run. So one of the things we considered is the reduced number of hours they will spend in school, and that will be announced. I'm sure the Commissioner for Education, when we be giving full analysis and full details before we open the schools, will let you know the number of hours they will spend. And mind you, these are just only SS3 and JS3. So once you get the details, you know the number of hours. I cannot come now without talking to the experts to tell you either we'll run those schools from 8 to 12:30 or from 8 to 1 or from 8 to 12. But certainly we'll reduce the number of hours they spend in school and reduce the amount of time of biological breaks. We might create like 2-3 biological breaks in between, like 15 minutes where they can just drink water and return. And one of the things we also need to do is that we will increase the number of people we put under education monitoring, that will monitor the compliances by principals and head of schools and head teachers. I think the Commissioner for Education had meetings with head teachers and heads of schools on these guidelines. So a lot more will be done. I learned somebody's already on the line for another question. Can I take another question?
Yes, Excellency. Hello, good evening. Hello. Hello, good evening. Please tell us the name and where you are calling us from. From London. Okay, welcome to the program. Your governor is here.
Thank you so much, Governor, Your Excellency.
Thank you, Achibong. Thank you.
We are quite happy with happening in COVID-19, and I'm just kind of thankful to your own people working around you. I'm very proud of our time state as well. And just want to ask a question that for some of us who have been trying for 1 year to kind of show how to make our measures safe, and it's quite hard. And most of us are here sponsoring ourselves, and then conclude at the moment. And I said, my parents that this is where I'm at now, so much appreciated. And I tend to have that kind of march in what that I conclude in my faith. Especially today, the access of Nigeria and how to care who was in that moment. So what sort of what areas that we see as when our presence, when our community ourselves as well.
Okay. Thank you for Excellency.
What was the question?
You're asking about how professionals, the diaspora, can key into the COVID-19 fight and other developmental programs of the state.
Okay, Achibong, thank you for your interest. And straight to the point, even some of our indigents in the United States of America have indicated interest. I think some of them came up, sent some materials, sanitizers, face masks, what they could afford, and it's well appreciated, and it was well reported. So please, wherever you are an Akwa, you want to help. Even if, don't send us cash so that you won't feel uncomfortable with that. You can send us equipment, you can send us other consumables, face masks, sanitizers, some of the regions that we use for testing. If you are that buoyant, you can send us some hospital equipment. We are using this a whole lot. As of today, we are trying to build a new oxygen plant by Tumba that 300 people can actually be attended to at the same time with all the volumes of oxygen requirements that they need. It's going to be first of its kind. And it's going to be in a container. It's containerized and will be there in Itumba. You can attend to 300 patients at the same minute without having any problem. And all of them will have the required quantity of oxygen they need at any point in time. So we're building that now in Itumba. Any help, any Akwa Ibom in diaspora can help us, or any Akwa Ibom anywhere you are, even if you are in Uyo here or in Akwa Ibom State, anywhere you are, even if you are across the river trying to also earn a living through, aquatic resources, you can also throw in a help. Nothing is too small. We'll acknowledge this and we'll make sure that we build these things and live. So we're interested in doing a whole lot because this is a call. This is a wake-up call to all Nigerians that we must put a lot of things in place for our people, and we are determined to do that.
Okay, Excellency, before we take some more calls, please permit me to bring up a particular issue here. We know that the local government elections will soon be conducted in Akwa Ibom State. And in view of COVID-19 and the new realities of the moment, have we thought of some kind of templates that the election would be COVID-19 compliant?
James, I thought you avoid the issue of elections and politics and everything. I'm happy you actually bring that in. Elections, tentatively, I think, I must confess, I've not had time to review the timetable of AKISEC. I am one governor that I believe, as the name implies, AKISEC must be 100% independent. Trust me, 100% independent. They mentioned something to me that they want to even create additional wards. I said, look at the law. If the law allows you to do it, but do it with all amount of justice, sincerity of purpose, and out of necessity. And when they explained to me, it was okay. I try not to influence these independent bodies. So if somebody is complaining about the election, I believe before AKISEC sets the template out, you can see even in Nigeria as a country, I think 2 elections will come up even before our local government election. Edo and Ondo will come up. AKISEC will also learn something from there. But I think election day, you go to vote individually and then you leave. You are not standing there to count or to do anything. So during local government election, I don't see that to be a major problem. As far as you can come out of your house, you can vote. And that's the essence AKISEC had been announcing, that they want to create some additional wards in order to, spread a little. But I think what they are doing that is also very fantastic is that they are giving each senatorial district equal number, irrespective of the number of local government areas in that your senatorial district. They don't, I think they told me, from what I heard, that it's about 13 per senatorial district. Every senatorial district, same number. Is still part of the measures they are taking to ensure that they spread, because some wards were really overcrowded. So they are taking this without necessarily, showing any form of bias or injustice. And I think being independent body, they will do a whole lot. So please don't be afraid. Local government election will not pose any threat because of COVID-19, because going to vote is just on an individual basis. Where we will need to monitor is how people do campaign. This is grassroots election. Grassroots election campaign at grassroots level is quite easy, because the people who are doing grassroots campaign, there are people within the locality. Some of these people, a whole ward that the councillor will come from might not be more than 2-3 villages. So to carry a horn speaker early in the morning as if the guy is preaching the gospel and announce that he's contesting for election will not pose a whole lot of danger in terms of COVID-19. We have reviewed this. I'm sure AKISEC, the chairman of AKISEC, is a well-experienced person on electoral matters. He will do the right thing. And I don't want to influence them so much. I know somebody also posted the same question about the PDP Congress that's coming up on Thursday, 30th of July. I said that's why we're taking it to the stadium, to the international stadium, so that there could be adequate spacing, social distancing, Nobody will come close to each other. And also, this is a delegate election. So somebody who is not a delegate will have no business to be there. They will put adequate security man. If you are not a delegate, if you come near that place, you have yourself to blame. Because we don't want people to throw caution to the wind at all. We expect that only those, and in fact, if you ask me, even if you are a delegate and you're not strong enough, nothing says that 100% of the people must vote in any election. If you feel you're not strong enough, or if you feel you are an aged person, please, and you don't feel like coming out, it's not a problem. I mean, it's a simple majority, because to me, people who are 65 and above, who are so exposed, who want to remain at home, should remain at home. So this is my personal opinion. I'm not speaking now as a party member. I'm speaking as a concerned citizen of Akwa Ibom, that these are measures that people need to look at. But that's why they are taking that Congress to the stadium, so that there could be adequate spacing of people and distancing. By the time you put just a few people in a capacity of 30,000 people around, you know that certainly nobody will come close to each other. And I also try to do something even these days as a governor. When I go out like that, don't greet me. You don't need to greet me. I wouldn't have anything against you. I know it's a sign of time. Please, you don't need to come close to me to greet me. So what I do this is, once I appear anywhere, I just greet everybody at the same time. Immediately I came up on this program, I greeted all Akwa Ibomites in Nigeria and in the diaspora. So I've greeted everybody. So I don't need to one-on-one start greeting people in any of such program. No, not at all. So that we can see how much this thing is a new order and we must conform.
Thank you. So, okay. Your Excellency, sir, when you started talking about agriculture, post-COVID-19 and otherwise, agriculture as the new field, especially for Akwa Ibom State. You recently also talked about an agriculture development bank in Akwa Ibom State.
No, I said microfinance bank, not agri development bank.
Yes. Agriculture in Akwa Ibom State. Can you give us an update on that? Knowing now that it has almost become the norm. You know, every little space you find somebody setting up a farm for planting or growing birds. How will this help?
Thank you. I believe what is happening today, we've succeeded. In fact, at the stage we are today, we can sustain the momentum. I would say we've succeeded. We've created the awareness. I keep telling people that for the fact that you are who you are, does not mean that when you come back home, you won't feel hungry. For the fact that you feel hungry, it means that you must do something. And any good leader must be interested on whether their people are being fed or not. Go to developed nations of the world. Let's take America, for example. There's no state, apart from 1 or 2 states in America, that 80% of what they eat do not come from that state. And these are very rich people. And look at also the top richest men on planet Earth. See how many of them are also involved in one way or the other, either financing or collaboration or collaborative efforts in terms of agriculture. I just talked about Canada. That 2% of the land mass in Canada produce wheat that can earn a whole lot of foreign. So I don't want to measure in terms of, I think it can be less than 25,000 metric tons or so. I mean, if I'm not mistaken. I might not be right with the statistics because I didn't check it. I've not been updated with the latest numbers. But what I'm saying here is, as a people, we must consciously know that the easiest way out of where we are now today is to go back to the ground. It did not start today. Even when God created man, the only way God found man for man's survival, prosperity and everything, prosperity and survival of man, was to take man back to the farm and show man that everything, and look at also survival of man today. There is no aspect of life of man that is not from the ground. Check it. Everything you see man surviving on is from the ground. The clothes you're wearing is from the ground. The cotton is planted. From the cotton you get the fiber. Fiber you get the clothes. So every single thing, the table we are sitting on is the wood. So every survivor today must be going back to where God showed man to be. And that's the only way the developed nations got to where they are today. So what that leaves us with is that we can actually carve out a niche for ourselves as a state, that we will grow agriculture that will take us into the agro-light industry, that will lead us to the industrialization that we are looking for. I mentioned this during our last meeting, and since then till today, I think Akis is back. When we check with the guy today, in less than 2 weeks, they've cultivated over 7 hectares of tomato and pepper, which I'm going to inspect. I told them our target was 100. within this period, because we are trying to break the cycles. We don't just want to grow all at the same time, and then we harvest, there's no market. We want to grow what the market, domestic market, can consume first. Once we can sustain, learn through our mistakes, because we are bound to make mistakes. We are making a lot of mistakes now because we are learning. Once we learn through our mistakes and then find our feet and then stabilize, and then we are coasting, that is when you start seeing what is going to happen. I don't want to let the cat out of the bag, but you know, very soon, between now and the end of next year, you see the avalanche of cottage industries that will spring up, that will actually start consuming a whole lot of this drive that we're making on agri. I encourage people to go into piggery and the rest of them. I say, look, sausage is a whole lot. We must not consume all here. But there are a whole lot of human beings in Africa. Nigeria alone is 200 million people. And people need protein, chicken. By the time we put all this together and process and then start selling, we can actually make a whole lot of foreign exchange, create a whole lot of employment, and also even fit well as a people. So I can preach this in a whole day and I won't be tired. Because even me as a governor, I keep repeating every day I have an opportunity. That I have a farmland too. Not with government money, not because I'm a governor, but because I know that's the only way out. So please, everybody, no matter who you are, even the richest man is involved one way or the other in agri. Bill Gates.
Okay.
I do
Rose?
have a question away from agriculture.
Yeah.
Recently, you approved tax reliefs for some businesses and individuals in the States. Is this part of the post-COVID-19 strategy to re-energize the economy? And is this going to affect the IGR of the States?
Certainly, yes. You see, if you must eat an omelette, you must break an egg. So that, you know, when I was talking about the tax relief and some of the post-COVID-19 issues we are doing, I redefined love to me as a sentiment. What we are trying to do here is we are trying to show the people that we care. That's number one, and that it's a sort of empathy, because you see, everybody is affected. When we were quite young, I repeat myself again, that anything that you do, they will say, can that affect a church? I'm sure since you were born, this is the first time you are seeing something coming up that all churches on planet Earth got closed down. No church could open. So it shows the extent of damage this can do to mankind. And if that's the case, little measures you can take, sacrifices you can make here or there, to show that you still support small and medium scale businesses, please, it's good to do it. And one of those ways we can show this is through some of the reliefs that we've announced to these small and medium scale enterprises. Will it affect IGR? The answer is yes. But at the same time, I mean, it's from the left hand to the right hand. Because even if we collect IGR, it's still to pass on to the same people. So what we can say now is, well, can we allow you at this time to breathe just an air of temporary relief so that your business will not just die? Come up, what you could have paid to us as tax, plow it back into the business and grow the business so that you don't create all those unemployment on people and the rest of them. So we are hoping that people will take that opportunity, just catching on it, and then grow the business. Because it's like, instead of us, since we don't have the cash, instead of us trying to look for cash to put in to people as, you know, relief measures, whatsoever, what we have as a tool, we can still pass on as relief measures. If you go to countries like America, they pump in like $3 trillion into the economy. They still say it's not enough. European Union met last week, and they said they're going to pump in about 750 million, either euros or, I think euros, 750 billion, or they mentioned some crazy billion, 750 billion euros. The European Union alone will pump it into about 18 countries, or 18 or 38 countries, if I'm not mistaken. I think 18 or 38 countries. 750 billion. So everybody, I mean, somewhere in developed nations, they are looking for what to do for their own people. But since we don't have the cash, we are a state government, we don't control policies, we don't print money, we cannot also lay hands on cash anywhere. What can we do? Certain policies that can also help ameliorate the suffering of our people. That's how we put the reliefs in place, just to help the people.
Excellency, I'm happy to report that presently this program is being followed by 3.8 million people all over the world on the total.
Excellent.
Beautiful.
I wish 3.8 million people can ask me questions.
quite unfortunate. And we have this one, I get exactly when I have this question from this diaspora. I'm happy that following what we're doing here. We have this question from Jemima Sien, says from Fatai.
In Uyo.
Okay, yes, absolutely. And I says the contest in the last election has been, he lives in Manchester. He wants to thank you for providing the super healthcare facilities, which he testifies as one who has worked in the mental health department in the UK for over 18 years. He says your condition is some of the best in the world. However, he complains about COVID-19 and its relationship to mental health as it's applicable in Europe. He has also talked about the fact that each time he comes down here and he sees people walking the street due to mental issues, he gets this. I would want to part of the contribution to solve the problem.
Please tell him he's welcome to make his contributions. But let me also tell this to Akwa Ibom people. We evacuate people with mental health issues very regularly. And once we finish treating these people and then they recover, we discover that a whole number of them are not from here. And I must say this, and I don't know whether I should change to vernacular.
Yes, and it's more frequent before.
Okay. So Giko is Rufo. I don't mean that send the vacant kusum, you don't be a gangen. Mbio when I say Kunidara do Dibon kusum. And he may try this in Kunidara from time to time. He might treat Arami, my Idama song. Obiamo Yoda confident to other places. So because Mbio Dion that can you make that a wakusum and we pack this that from time to time. But we have to when say they drop it Arami Kunuyo, then they go back. So I'm going to reason check and go. Tell me, me that say good go you would you anywhere. But because the only government you make it that because some me say you might dream those who will find their way back. I told me I'm using a treat kit. Me I'm don't be a Bible. You never get some. Me I'm my tongue got different. That's how you need the young. Me I'm my song. They will be wondering. They guess I did warm me away the young. So some my tongue trace they get to. So I think the social welfare department is a try. I think now so I'm because I'm not doing near for being now. You gotta go help because they go forget that do some. But we are about to give it on them at that point in time. But I'm not sure for the young that I get to government. So Jemima, anything you can do to help in terms of mental illness, mental health will be highly welcome. It's one area I know we've not done so much, but the little we do, we need help. As that today is only the mental hospital in Eke, psychiatric hospital in Eke, that is functioning, which we are also trying to renovate and put some new facilities in place. I don't see us doing a whole lot more. Our emphasis after that now will be mainly into School of Nursing and Midwifery. We are going to be a little bit aggressive in establishing those training centers to train more nurses, because we also learned and I've also discovered over time that at times it's not enough to understand medical sciences. Even bedside manners can help determine whether somebody recovers much faster or not. So Jemima, you can help us in any way you can. Thank you.
Your Excellency, the beautiful thing about this program, the last 4 editions have been equal to for. I want to tell you what happened after the last one we did.
Yeah.
An elderly woman met me in my community. I would go over I can't go. So as we do the closing formalities, Your Excellency, get with this one and we don't be done. But I'm going to go on COVID-19 and that. Let's leave us for down this year.
But down this year. Okay. Sia moderator ngaba dan igon kan ni bon don mfunu don e ba mi e ko do COVID-19 mi men mo free I don e ko dan bo mi ba ay government na boy ido government bi kari na afun bo ina ofre wo utom government do bodi yo iso goni udom ni se dan ni ke unwam anyi ogbogede medini ni mbogide mo sefoni e di na midem fo ado feri kedbo ke moimi sa kedan bo sa yaram boy bo yarami den bok ya no antan ko aba sikitepe mimmi anyere kerege bo gi fonno e kayin abene yina senedem ma ben bo me bobo yini wo anu obene yina me senedem abop afofo atigi wonde kan yina do ma agba ku sen ntere yin mbogi wo at all. Please. Ubude kayin, ku foreign terayin mask, ya no ntanga ko ku bena foreign fok terayin giwo. As far as I said na yin rokedem. Akasa ke bika, Africa modo buka do protect us from mbok ku sena yin kedem nu bena from obok, nu ben mask na mutu ku word de ka yin do pa, and it has happened. So please, make kayin, ikba moto go begin nam uto mistake do. And at this time, uto ini emi do ini mbok se wo so kaman to yin to do insect ese an ku song. Usong baba ya yin ro tie ku fo. So say ka do mean ke yin and the car. In fact, I do much better for the benero kain one than for the benero ka odwa ko to ini em. Ku kaman se yin u ka odwa me public place or make be kai tiem pa wo. So ya giben se yin I bope dem. Abandanya tong you no odudu. Mun si sem boy ba be kan te bo yin dem kai tiem pa wo o kai tien do. You no offend. You no offend because in so na ga be gina mi tiem pa wo do benen se yin do. Abena bope dem aka. So ya you no do ba ku fo ka se be ka sop nyong de ku gbene ida me wi gbene ga bo ba. Even tiem pa wo da me gbene ga so ku gbene se ka sop te me di nyong fo. Mbok. Ye imam government nyong ma mi dem fonko. Mfana fete government nam adoken thankful. Bire gesen fo boku don ara di me ke mo ye sa dan bo sa ke mo bi si pere me ke to mi am parawa e ke bo ke mpo mi ni ara sa eso e ruma mo ba sa an ko son eso e nanam dum e bo ke do mbre isa ke do at do so do to please dan gba kaka ku yak e dem fo na ke ru gbe dem no wo yara si bo yara me gi wo yara fo inwa ku ya wo ngene foko ake mo no ya yara at all ku bene go wo yara ogbodok keke or ke dok moto wo bi si no ku bo kama kemfo yara ki dem fo ku bo wo yara ki fo no at all kana wo mang bi tan go no me yara gam bodo bo kan ku ya wo san gbere tan go no abi awo do gbedo so ibo ga do wan mebe bere ma bi tan go no even a yinfo ya yara mbodo gi no because of we ka amege ni am fana udon afuru di yonge bere yana ni am fana ayina do gemi sa to zumba do ku ngi dem idi yonge ga mai do dem se bere fure ka because of iswa e man for me fun bo mbodo mo do fin dem bode ayaba from a yinfo so mbo me ba mbo ima yin no mbo ima yineka ya fra we sa ada we sa mai sa andro mfrin de ga bi ba. So once again, let me thank all our listeners, the number of people that join us across the globe. I would have loved us to talk a little bit more about the economy, but today, because at the stage of the COVID-19, we are at the community transmission stage, I had to dwell a lot more into the COVID-19 issues. I'm sure when next I appear on this program, I'll take you through some of the economic issues that we've tried to handle within this period in time, and some other developments that we do. And I want to believe God will help us. For workers, please, this is not the time to make unreasonable demands. Try and let's be responsible in our demands, and let's also be responsible in our actions and our inactions. Irini, the run down state and photo. Biofen edodion senior, Kuba Biat Sevonia, Frefenian, in our domain in Amia state, in another Kadam Bo Fon Union. Often be an Amuyumi, who never say, Madame Tanza. State you may produce earn in our football. Then again get presents you now are next thing you know me. At that exam of Leganama, who pay tax, I don't friend, not to talk of any other thing. So, saying you can come and nam naidem encourage Monsieur Yeminam, Kubabia, Monsieur Yeminam. I want to thank all the listeners, those who are from Akwa Ibom, those who are not from Akwa Ibom, those who listen to us, those who decided to share with us. And you could also see today we try to play down the numbers, because our interest is no more on the numbers. Our interest is more on the preventive guidelines that we want everybody to abide. Please try and abide to all COVID-19 preventive guidelines. That will help us a whole lot. Finally, I pray no life is lost anymore to coronavirus, and God will protect all of us as we go about our normal daily endeavors. We'll be back with the announcement on how to open schools and get our students ready in order to write WAEC, so that we must score the minimum benchmark of 5 credits, including English and Maths, of at least 80% as we go into the next WAEC. Thank you and God bless you all. See you in a short while.
Thank you, Excellency, for funding internal of the very busy schedule to talk to Akwa Ibom people. No wonder we've always believed that you take the business of governance so very seriously. Thank you, Excellency. It's been 2 hours of the governor's speaks. It's been worthwhile, and we'd like to thank over 3.8 million people who follow this program on the social media, and for the millions more who listen to us on radio as well as watch it on television. And on that note, we'd like to thank the AKBC, Radio and Television, Comfort Radio, Inspiration FM, XLFM, Atlantic, in fact, all the radio stations.
And thank you, Bon Rose, as well.
I'm going to that, Excellency, and all those who will join us on the program. His Excellency came here with a very strong backroom staff talking about the Secretary to State Government and the Chairman of the COVID-19 Task Force, Dr. Emmanuel, the Chief of Staff to His Excellency the Governor of Paraguay, the Chief Executive Producer of this program, Mr. Charles Udom, and of course the Commissioner for Health and the Incident Management Committee of the State IMC, Dr. Dominic Udom, the man who has made education on radio, school on radio possible, Commissioner for Education, Professor Nsei also came around, and of course the Chief Press Secretary to the Governor Paraguay, Udom, not forgetting the Director General of Akwa Ibom Broadcasting Corporation, and of course the General Managers of all these other stations who hooked up to the program. My name is James Elliott, and on behalf of Akwa Ibom and Rose Akai, it's been worthwhile. We'll see you when next the duties of office allows His Excellency to be here. Thank you, Excellency.
Thank you.
Good evening. Good evening and good evening.